Well, the sheriff says that those who are deemed a danger to themselves or others should not be able to access firearms, even if the clarification on those intake forms change by the patient.
I believe there's a loophole in the mental health system with possession of a firearm.
Bucks County Sheriff Fred Herron says he has seen it as a patrol officer and director of public safety. Patients who are so dangerous to themselves or others, they're held on an involuntary hold. In Pennsylvania, it's typically referred to as a 302 hold.
What comes with a 302 is that you can never possess a firearm again because you have mental health issues. So what's happening in the past couple of years is that people are being talked into 201ing themselves, which is a voluntary mental health commitment. The problem with that is this: as soon as then the police officers leave the hospital and the swearing out party leaves the hospital and you 201 yourself, 10 minutes later you can walk out the door. And then you can go buy a gun.
Herron says if a patient is thought to be so dangerous that self-commitment or 201 should come with the same firearms restrictions, even when the treatment is complete.
If you have a mental health problem where somebody thinks you shouldn't possess a gun, it shouldn't matter whether you're 201'd or 302'd. And that lies the problem with our system.
For 201, I believe that in my experience, what they are looking at is in terms of stability. If a patient can voluntarily take themselves to a psychiatric facility for a number of different reasons, and those reasons may or may not put that patient at risk or other individuals at risk of harm from a firearm.
Steve Wancheski, Senior Director of Behavioral Health at Roxborough Memorial Hospital and the Suburban Behavioral Campus, says not all patients should qualify for a 302. And he says once that 302 paperwork is submitted, state police have been notified, even if the status on the patient changes. And he says everyone can do a better job in spotting mental health issues before they rise to severe levels.
If we have friends or family that we see have lost interest or aren't reaching out as they previously did, we need to reach out to those folks, and we need to just ask each other how we're doing.
Wancheski says federal cuts to Medicaid and the shuttering of local hospitals have made getting treatment for those in need even more difficult.
Benjamin Franklin identified the mental health crisis in 1751 in Pennsylvania at the time. And here we are, 2025, and it hasn't gotten any better.
Now, when it comes to that 302 paperwork, copies are sent to state police. They maintain those records as to who should and should not have a firearm as it relates to those mental health cases. And then that information is also uploaded to a national database. Reporting live in Doylestown, Deanna Durante, NBC 10 News.